Welcome to the Intuitive Pool podcast. I am so delighted this morning to be interviewing somebody that's very, very special to me, Dr. Carol Haddad, who is an integrative oncologist and is the founder of ICCA, which stands for Integrative Cancer Care Australia. Hello, Carol.
Oh, it's wonderful to be here with you, Giselle. How's it
Yay.
going?
As usual, I know because I wanted to say this to the viewers and the listeners that we have had a few podcast episodes in the past. One of them was at the end of 2021, so that's a while ago now. And then I
Which
think I think the other one was 2022, I think, or it could have been 2023, but still time has passed. So it's good to be together again and let's see where this conversation wants to go. We both had the pull to record this episode. So let this episode be the medicine that people didn't know they were looking for, really.
that sounds like a strong intention. Absolutely.
Yeah, thank you. So, for the people who have not viewed, or actually, we weren't on video back then, for the people who didn't listen to those episodes, can you share a little bit about yourself so that people can kind of get the lay of the land about who Dr. Carol Haddad is, please?
Very gladly. So, my professional background is as a radiation oncologist, and I worked in a conventional hospital setting for 10 years or more. And I really loved working in the setting of cancer until I just started to become a little disheartened with the results that I started seeing for my patients. And it was at that point that I started to become curious about what else might be available in the big wide world that we could offer and see what we could do in terms of improving the outcomes that we were seeing. So it was at that point that I went on a beautiful global exploration, both for myself and personally, but I didn't realize that a lot of it was actually professionally. It was to show me the different ways that others were becoming well and staying well in the setting of chronic disease and cancer. And it educated me in the other things that could be offered to patients, as well as conventional medicine, to improve outcomes. And I always like to tell people I went from one extreme to the other. So I went from the extreme of conventional medicine to the extreme of thinking that wasn't necessary and that I could possibly practice in alternative ways. But actually, I found that the best path was the middle way, so to speak. And so now I work in an integrative manner. I advise on the complementary and integrative therapies alongside people's conventional care. And we see that outcomes are superior to those who pursue either route alone. And our latest offering is, as you mentioned, Integrative Cancer Care Australia. Huge, there's a huge demand for it in Australia, and there's very little in terms of supply. So we're hoping to provide and bridge that gap that we see is present, and bring this approach to many more people.
So wonderful, so wonderful. And thank you for bringing that to Australia because, yes, as you said, there's not a lot of options out there. So it might it might be um, a big ask to answer this question. So I can only imagine that you're going to answer it from a high level place. What is the medicine for cancer?
What a beautiful question. That has been evolving and that's why, you mentioned our earlier podcasts were in 2021 or 2022. The conversation today is very different because I feel the information keeps evolving and the concept and the approach keeps evolving. Originally, I thought that conventional medicine was the medicine, right? And then I thought that alternative medicine was the medicine. And then I thought integrative approach was the medicine. And now, if we go to a higher level thinking, and the reason that I've gone higher level is because even though we've improved outcomes with an integrative approach, I started to notice that it wasn't necessarily that you could just offer exactly the same protocol within the same cancer diagnosis or stage and necessarily achieve the same outcomes for people, for patients. And so I started to think about, well, what is different among these patients that have similar staging, similar cancers, and why does the protocol work for some and not the other? And so this was a next door that needed to be opened so that we could find an answer and step through it. I also, I'll get to what I'm thinking in a minute, but I also love how you've always mentioned that love is the medicine. And I still feel that love is a huge player in the medicine. And I feel that it comes in different ways, and we can probably talk about that, and how love comes through. But from my perspective, now I'm noticing that it is the hero's journey. So the reason that we're not actually able to just copy and paste a protocol from one patient to another is because it is essentially patient-led. The patient tells us what is their medicine. The patient is the creator of their medicine.
Wow. Wow. What a statement that is.
Mm.
The patient is the creator of their medicine.
Mm.
Wow. That is a premise and a half, that one right there.
Just as we are not the people that heal others, they are the ones that heal themselves. We are merely holding their hand along the journey. So they tell us, they tell us. And as I think back on it, it's not far off. You quote Kelly Turner's work as well. And one of the aspects in Kelly Turner's now 10 factors that lead to or are more likely to result in radical remission, one of them is self-advocacy. It's someone who takes their health into their own hands and really goes on their own, I'm calling it now, hero's journey. And I know that you and I have shared mutual patients and have seen the results for some of those people. And it's very heartwarming, but it's also unique. We could never have prescribed that for them. Yeah, they had to discover it. We helped them perhaps discover it, but then we just stayed out of the way. We didn't block that. And we allowed them to go running with it.
And it's just the greatest privilege, isn't it? Like my heart is so warm when you
Mm.
speak about these people that we've both supported.
Mm.
And it's true, the power is within them.
Mm.
And that's the difference, isn't it? Because normally we believe that we are powerless to the medical profession, that the medical profession have the power, they've got the knowledge, they've got the wisdom, they know the way forward. And so we put our power in them. And yet, that's not what we're talking about here. We're absolutely talking about a partnership, but the primary power sits within the person themselves
It sure does.
as they go on their hero's journey. And love is the medicine. When I talk about love, I don't talk about romantic love. That's really important to mention. I'm talking about the consciousness of love that knows that cancer has a plan for them. And it might not necessarily be death. It may be the plan of supporting them to come home to themselves, to undo perhaps the things that may have created the cancer. We'll never know. But one of the things that I know that you and I have seen in common with some of the people that we have both supported is that there seems to be a common denominator of control. That a lot of people that we have worked with have walked life and led their lives with the need to control themselves, the need to control others, the need to control their environment. And then cancer comes along and it's the one thing they can't control. And so then cancer becomes the catalyst for the undoing of that and the catalyst into a new relationship with themselves beyond the need to control that is so much richer, so much fuller, so much more joyful. Yeah.
Beautifully said.
Yeah, thank you. Thank you. What would if you could tell those people who have cancer and are ready to hear this message, because not everybody is ready to hear the place from which both you and I hold cancer. If there was one thing that you wish that you could tell them, the people who may be watching this video or listening to this video, what would it be?
Hmm. It's a good question. I think I have three things that come to my mind.
Amazing.
The first is that one of the things you mentioned about control is plays a role in the development of cancer. And the way I also see it is it's self-denial. It's actually a denial of self. And I think that that's a major player in the development of cancer. Whether that's shutting down your own intuition, whether it's shutting down the connection to your emotions, whether it's shutting down what is naturally an expression for you, I feel like it is that suppression that that can be a catalyst or risk factor for the development of disease. So my thinking, and I know that this is slightly controversial and sometimes feels a little bit cushy, but I feel like cancer arrives as a catalyst for the awakening, the great awakening. And what you've just described is the return home to oneself. And there are different ways of thinking about it. I don't want to feel like I would know how I would react in a situation where I received a diagnosis, but it may be helpful for people to see it as an invitation to come home to themselves. And I know that you and I have both heard it multiple times that people feel healthier and more whole and complete after cancer than before. So I only imagine what is the blessing that it is here to bring, even though we can receive that blessing in other ways and other modalities. I'm not denying that. But for some, the journey is through the catalyst that is cancer.
Mm.
I'd say that they're two of the things I'd like to say. And the third thing is that this is also controversial. I think that healing is outside of a practitioner's hands, but I feel like although healing is possibly within an individual's hands, it is also still part of a bigger picture. So I don't know that we could ever know as practitioners, or that maybe even the self knows every time about what will be the outcome. And I just want to say that to premise that everything we do kind of needs to be held without attachment to the outcome. And the only reason I say that is because sometimes without attachment to the outcome, double-edged sword, the desired outcome is what's more available because we've released and surrendered into that. Yeah. So they're the things I think I would say.
Thank you. Thank you. That last piece is a tricky one, isn't it?
It really
It's a
is.
real tricky one. Yeah. Yeah.
Mhm.
And and it's true. And it's true. And then there's this fine line between detaching from the outcome and having the self-advocacy, as you say, the determination, the fire, the will to heal, because
Mm.
that's also really necessary. So it's such a fine line to have that determination, fire, and will, and not to control the outcome. It's such a fine line.
Mm.
Yeah.
Right, it's taking action without attachment to outcome. It
Yes,
almost feels paradoxical. Yeah.
exactly. Exactly. And especially when we're talking about life and death.
Mm.
Yeah.
It
Yeah.
sure is. Yeah.
Yeah. What would you like to say again, knowing that this video is going out and both of us have great intention that the video will be received by the people who are ready to receive it? So you've spoken to the person with cancer so far.
Mm.
What would you like to say to the medical profession who are ready to receive
Mm.
what you would like to say to them? What would you like to say to them?
Yeah, that's a beautiful question too. And that's a topic that's very dear to my heart.
Yeah.
It was in 2016 when I stepped aside from the hospital setting And I started to explore, and I remember writing one of the first initial blog posts that I ever wrote when stepping laterally, about conscious consultation. Essentially, that's what I decided to call it. And it was because I was observing myself in particular scenarios and other doctors in in consultation with patients, and different types of doctors, different specialists, and even the specialization almost curated a particular type of bedside manner, if that makes sense.
Yeah.
And I noticed, or at least I haven't done any randomized control studies on this, so please forgive me, medical world, for not having the gold standard of evidence. But I noticed just how much of an impact a doctor's bedside manner can have on the well-being of a patient, whether it's quality of life and their sense of how they feel from day to day, even from symptoms, and then even in terms of outcomes. So the what's important to consider here is that we as practitioners, and not just the medical field, but practitioners across the board, this is as relevant to an acupuncturist as it is to a doctor, as it is to a Reiki practitioner, as it is to a naturopath. Our bedside manner and our approach with patients is of the utmost importance. It is an energetic transmission. And if we're aware of that, it at least allows us to put ourselves in a position where we can be of the highest transmission. And whether they are receiving it or not, or consciously receiving it or not, those that we're in consultation with are going to be benefiting or not from the energy that we're putting out there.
Yeah.
So I think that's important. And when I became more aware of the importance of that, um, I'd like to say I started working on myself more, because I realized that the more centered I was, then the more centered I could bring into a consultation. And hopefully that transmission then becomes more powerful. And that's where healing ourselves, it always starts there, right? It
We
always
go
starts.
first. We go
Mhm,
first, right?
mhm.
Always,
Yeah.
always. What have you seen when the bedside manner has not been conscious?
I want to say that I have deep compassion for practitioners, that they're always working from the knowledge set that they're coming from. And I also believe that, at least from a lot of the colleagues I have, they're well-intentioned, and they're working from the, again, the body of knowledge that they have studied, that they're well versed in, that they understand, and that they know to be accurate and believe to be accurate. So I have deep compassion for believing where they're coming from and understanding that. However, I do feel in the medical profession, we don't necessarily evoke power in our patients at all times. I feel that sometimes we invite them to give that power over to the medical profession or to us. And I know that that's not necessarily intentional. I think that sometimes that's just something that is a consequence of the interaction. But I feel that the power can be evenly, more balanced, more evenly distributed between those involved, if not even handed back to the patient.
Wow.
So I feel like in some settings, when we are talking around prognosis and when we are talking about numbers and statistics and averages, I do feel that that can render a patient quite powerless. And I feel we need to be more aware of what our language, both vocal language and our body language, and the information we're sharing, just the power that that holds. And yeah, how much we can do
Mhm.
to support the mindset in one direction or another.
Yeah, beautifully said, Carol. I've definitely seen the impact on some clients where the oncologist may have just said a few words, and just those few words have created so much fear and temporarily has undone a lot of the good work temporarily until they're reminded. So yeah, that was beautifully said. And I actually remember, from personal experience when my mum had a heart attack years ago and we were assigned a cardiologist, and mum and I would go and sit outside his rooms, and we would be nervous, like as if we were going to see the school principal, and one day I thought, what are we doing? What are we doing? Like, this is not the relationship that we need to have. And I remember that we had the power in that moment. And so then we went and chose some other cardiologists, and the transmission that they give mum every time I'm in their rooms, because I go with her, it's full of love. It's full of respect. It's full of sensitivity. It's just beautiful. And that is the medicine. That is part of the medicine. She has a pacemaker in there, defibrillator in there, and yet it's their energy that is also the medicine, 100%. Yeah. Yeah. What has been one of your most humbling experiences as a doctor?
Hmm. Whenever I lose a patient, that is very dear to my heart. Yeah.
Yeah.
It makes me wonder again what I wondered in back in 2016. It makes me wonder again, what are we missing? What is the component that we haven't yet found that we need to add in? Is it physical? Is it mind? Is it spirit? Um, we're taking holistic approaches now. We're taking individualized approaches now. We're taking integrative approaches now. I still feel like we're doing the very best we can, and yet we still lose people.
Mm,
And to me, especially when I have formed a very close relationship with them and really stood by them in some of the most vulnerable years of their lives,
mm,
um, it's always humbling to,
mm.
yeah, to
Yeah.
lose someone.
Yeah.
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 Mm. Mm.
And what about when you've been humbled, not because you've lost somebody, but because they've gone into remission?
Mm. That's the other side of the coin. Um, yeah, I guess they are my greatest teachers. I mean, they're all my greatest teachers, right? They are all my greatest teachers. But for those who do go into remission on a diagnosis that you would never imagine they could recover from, um, I learn so much from. I really do. They teach me how to evolve the concept and the philosophy and the practice. And then what is also humbling is to see what they then go and create in the world. Um, I mean, if I can give a few examples, and this really, really warms my heart. I've had one woman who was looking, because one of the things I recommend is essentially detoxifying your life. So changing all your products from those with toxins and chemicals to natural products. And it was so hard for her to find these products when she was going through her treatment journey, that when she was well enough, she essentially created an online platform where people can, and she has sourced all these products and she's branded them and they're all Australian made. And so now essentially she has this online platform where people can order all of the natural products they need for their self-care. So she's gone on to do that. I've had another patient who's created, Cancer Connections, where she works with people to essentially connect them with practitioners and other services that she wished she had had at the beginning of her diagnosis. A mutual patient of ours is currently writing a book about her experience that may also contain very nourishing recipes and ideas of how to go on your journey. So the ripple of impact that we talk about is wide, and that ripple of impact is always humbling. Uh,
Mm,
Yeah, and they're just a few of the examples. And then there are lots that I probably don't even know about that have
Yes,
gone and yeah, really
yes.
impact in their communities and their families in ways we can't even fathom. Mm.
Oh, well, the person that you were talking about, the mutual person whose husband painted the painting behind me to thank us for the work that we did because she's now in remission and she's currently on safari. I've been on Messenger with her over the weekend. She's having the most amazing time. Before
Mm.
you talked about, we are humbled because we learn from them. They're our teachers. And just last week, I shared something with you that came out of her mouth. She'd never thought about it until we were speaking. And she said, while she's in remission, she's now learning about being in remission mentally,
Mhm.
letting her mind catch up with the fact that her body is well, rather than her mind, you know, having fear sitting there in the background. What if it comes back? What if it comes back? And so she's now, and you and I had never heard of or even thought about the concept of mental remission.
Mhm. Remission of the mind, just truly, truly, what a beautiful concept, And yeah, the way she said it, I don't think that we thought about it that way, or I've even heard it expressed in that way.
No,
But yeah, truly a concept that I feel I want to talk to in future and introduce to
absolutely.
patients. Yeah.
Absolutely. And so now her process is she's understanding through her own lived experience what remission of the mind is so that
Mm.
she can teach it and perhaps it will go into her book. Well, I'm sure it
Mhm.
will.
I hope it does. Tell her.
Yeah, I will. She's going to listen. All right. I am also aware that you are going to be running a retreat coming
Mm.
up. So,
Mhm.
is there anything you want to say about that?
Yes, I'd love to invite people to join us. So it's me and my dear, dear friend and colleague, Sammy. Sammy is a pranic healer and she has Ripple Healing is her service and her offering. And this is our fourth retreat offering together. The first three have been in Noosa and they have been an absolute delight, just one of the greatest joys and pleasures to for me to be doing, really, and I know for her as well. And so our next one is going to be in the Byron hinterland area, and it's dated from the 28th of October 2025 till the 2nd of November this year. And there are still places available, and we would love to have you join us if you're listening out there. It's not only open to those with a journey or a history or a current diagnosis of cancer, but for anyone who's looking for multidimensional healing. And what we mean by that is healing on levels and realms that we can't really fathom, that Sammy and I can't even describe beforehand because we only discover it in the process of retreat. And I can almost guarantee that we all come out on the other side so much more whole. And that's the only thing I can say about it. But we've got a beautiful chef who creates the most just food full of life force. It's medicinal in itself. The grounds are absolutely beautiful, and it's been such a well and intentionally curated itinerary with a few surprises built in. And yeah, I don't think people will regret it if they take the energy to attend. Mm.
Yes, I will definitely put the link to the retreat in the show notes.
Mm.
And also, I will put links to reach you
Mhm.
personally in the show notes too, either through ICCA or through Dr. Carol Haddad. Yes.
Yeah,
Yes,
perfect.
perfect. Is
Mhm.
there anything else you'd like to say as we complete today?
Yeah, just that, I guess through the vision of ICCA and working one-on-one with practitioners, we understand that that's not always realistic or reasonable for people to access. And so one of our goals is to create an e-course, and we'd like people to be able to essentially access the information we try to portray through consultations online. So watch that space very carefully and also let us know what you need, what you wish for, because as we create it and continue to evolve it, we want to know what is in demand, and we want to fill the gap that may not be filled by any other service out there, especially on Australian shores. Um, and yeah, I think that's all.
Okay, perfect. So again, I'll put your details in the show notes. So if anybody's interested in the e-course, they can reach out
Yeah,
about that. And equally, if they would like to have a consultation with you or through ICCA, details will be in the show notes.
perfect.
Thank you so much for being with me for the third time on the podcast.
It's always a pleasure to be with you on this platform, Giselle. Thank you for
Thank
having
you. Thank
me.
you. Thank you. And as I said, in the opening, I really do hope that what we've spoken about today is the medicine
Mm.
that people didn't know they were looking for, and may it create many wonderful things. Yeah. Thank you, Carol.
Thank you.